Sephora stores are everywhere you are. So just pop in. When you need a brown lip to match your 90s playlist. A confidence boost before your interview? Or a last-minute gift for mom's birthday. There's always a Sephora near you. Just pop in. Use our store locator to find your local Sephora or Sephora at Kohl's.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steyer, a public health scientist, and today I'm joined by Dr. Ellen Gendler, board-certified dermatologist and science communicator, as well as clinical associate professor of dermatology at NYU Langone. You can follow her at Ellen Gendler MD on Instagram. Today, we are going to talk about Sephora Try-Ons, a popular trend among kids. The clock is ticking, so let's get to it. All right, Ellen, so we've been talking about this. There's this trend. Some people know it as Sephora Try-Ons, others as Sephora Kids. It's all over TikTok. It refers to kids, preteens, teens who are fascinated by high-end beauty products and skincare. They post videos of their makeup hauls from Sephora and Ulta on social media, and some even adopt very elaborate adult-like skincare routines. So let's talk about this. So Ellen, could this early and unsupervised exposure to a wide range of skincare and makeup products lead to any specific skin problems for younger children or teens, such as irritation, breakouts, or perhaps trigger allergic reactions?
Listen, this is a trend of kids trying to be grown-ups, like some of us might have done, taking our mother's clothes and their high heels, and short of breaking our leg walking in the high heels, nothing bad could come of that. But in this situation, there's lots of things that can happen. Number one, kids are being exposed to products that they have no need for. For instance, retinoids. If a teenager or a preteen has acne, retinoids by prescription are excellent products to use to fix that problem. But using topical over-the-counter retinoids, completely unnecessary, irritating, and ridiculous for a preteen who doesn't have acne. So that's my first problem with this is what the things they're exposed to. Yes, if they have an allergy to a particular ingredient, a preservative, or something in the vehicle, and they don't use lots of products, they might not know, and now they will know because if they're using these all the time, it can be troubling. And then the makeup, that's really another issue. What 12-year-old is going to be skilled enough to apply mascara? That's a huge problem. And figuring out how they remove makeup properly, all of this is troubling to me, all of it.
So what I'm hearing you saying is that there are certain ingredient categories and types of skincare and makeup products that are simply unsuitable for young skin. Is that right?
Absolutely. Acids, they have no reason to be using antioxidants like vitamin C or glycolic acid pads. These are products that should be used on adult skin, not on children, not on preteens.
So let's talk hygiene and safety. So with unsupervised try-on sessions happening, are there increased risks of spreading skin infections or other health concerns?
100%. And I hate to even say this, but last week I had a patient who was in here, had no exposure other than that she was at one of these stores trying on different makeup products. Had the worst case of primary herpes that I've ever seen. She had not had contact, hadn't kissed anyone. It was the only thing she had done, and it was terrible. So you can't rely on a 13-year-old to safely do a try-on where she puts the little applicator in and then uses it and throws it out. They dip it 3 times. Totally inappropriate and terrifying, especially with lip products. That is a big concern for me.
Mm-hmm. And Ellen, we were talking before we hit record that, these stores typically set things up where you can use something, they have the lip applicators, their mascara applicators, and then you're supposed to dispose of them. But a lot of times the kids don't do this.
That's one thing. And the other problem that I have seen is they run out of applicators. And so the kids actually use it with their fingers. It's a terrible idea. Terrible. I never use those things, and I'm an adult.
All right, last question. Could this trend contribute to unrealistic beauty standards, body image issues, or self-esteem concerns for this age group?
Oh, sure. As with anything else on Instagram, filters, etc. Having young children putting makeup on to make themselves, quote, more attractive or to try to fit in is a terrible thing. I guess in limited exposures, it's not the worst thing if these kids buy one product here, one product there. But I have young girls coming into my office with literally bags of products from Sephora and Ulta. I don't know how their parents allow them to spend this money. And even if they earn it babysitting, they shouldn't be spending it on this. I have a real big problem with kids trying to be adults. We're already adults for way too long. There's no need to extend it to a 12-year-old.
Well, thank you so much for your time and expertise. Again, you can follow Dr. Ellen Gendler on Instagram at Ellen Gendler MD. All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your bite of health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.